Voss Speros Financial, secondary plans. You're going on Medicare. The first time you get to choose, Medicare is an 80-20. They cover 80% of everything. You're responsible for 20%. So basically, the Part B is the 20% you're covering. The doctors. All the providers are 20%. There's a deductible for Part A and Part B. The Part A is big. The Part B is small. But if you go on a Plan G, a supplement plan, you're gonna pay monthly for that as a secondary, and they're gonna pay your co-payments. So pay monthly for the Plan G, pay co-payments over here. If you go on an Advantage, they're gonna cover that. You're not paying a monthly premium, but you're gonna pay co-payments for service. So going on Medicare for the first time, your Part B premium is about $185. Now, you need a Part D plan as well, so that's going to be, if you get that by itself, it's about $30, and then if you get a supplement, you're about $170, depending on where you are in the country or the county. So you can add that up to see what it would be for a supplement. On the other side, if you go with a Medicare Advantage, the Medicare Advantage plans kind of mimic like our current commercial plans, whereas there's no deductible, but there's a maximum out of pocket. And then each thing has a co-payment for service. So there's generally no monthly premium, co-payments for service. Yes, Advantage plans have a network, but they also have PPO plans. And don't let people fool you. Those give you in and out of network. There is a higher co-payment for out of network, but you still get access to out of network doctors if you want them. And if you're with a big carrier, you can go anywhere in the country. That's really good. If you kind of calculate that out, your monthly premium for a supplement, any doctor that takes Medicare you can see, but you're paying monthly for it. Versus you see a doctor out of network one time. You know, these are the decisions you need to make coming on to Medicare or on Medicare. Is it, what's your health? What your health care is going to be, you don't really know. If you're healthy, you're healthy. But going on a supplement later in life, because you're unhealthy, you can't do that. There is underwriting after turning 65. There's underwriting going on supplement plans. So take that into account when you're making the decision. Right now, you have a guaranteed issue to go on a Medicare supplement plan. And for what I pay for my commercial insurance, going on Medicare with a supplement and a Part D is actually cheaper than what I'm paying right now for health insurance. So actually, it's a pretty good deal. And then you can always go to an Advantage plan later and you get a 12-month grace period to try it out. So maybe you want to go that route. Or maybe you just want to save money and whatever you would pay for your Medicare supplement, you put it in a separate account, save it up, and then just use the Advantage and use that separate account for your co-payments. So there's a couple of things to think about. But if you're having troubles, give us a call. We'd be more than happy to help you discuss the plan options.